Lesson 18. The role of spirituality in maintaining the mental health of the caregiver and the person who is ill. In the everyday life of a caregiver, it is very easy to focus exclusively on two areas, the medical and the practical. All your energy goes into arranging appointments, monitoring medication, responding to crises, and keeping daily life in order. Over time, however, a sense begins to appear that this is not enough, that pharmacology and logistics alone cannot carry the weight of caring for the ill person and for yourself. Contemporary psychiatry is speaking more and more clearly about something that used to be mentioned only informally. A person needs one more pillar, just as important as psychology and biology. They need spirituality. Spirituality does not have to be a religion or a specific belief system. In clinical terms, it means a sense of meaning, deeper rootedness, and an inner moral orientation. It is the capacity to pause, reflect, and look at your life from a perspective wider than the current crisis. Regardless of whether your spiritual life is rooted in a religious tradition, in meditation, in a sense of connection with nature, or in simple everyday rituals of quiet, it serves the same function. It stabilizes the psyche. In caring for a person with a mental illness, spirituality becomes more than an add-on. It is a space in which you can breathe when everyday life becomes too heavy. It is a place you can return to when you lose patience, when helplessness appears, or when you feel that the other person's illness is starting to drag you into its whirlpools. It is also a path toward regaining a sense of meaning, because long-term caregiving often erodes it, and a person without meaning very quickly starts to lose strength. Research on the impact of spirituality on mental health. Modern psychiatry does not approach spirituality intuitively or by feel. It is an area that has been carefully studied in population, clinical, and neurobiological models. The findings are consistent. People who engage in spiritual practices, regardless of their form, have a more stable nervous system, lower levels of stress, and a reduced risk of relapse of mental disorders. One of the most important findings concerns the impact of spirituality on the body's stress response. According to studies from the Harvard Mind-Body Institute, regular meditation or prayer practices reduce cortisol levels by an average of 15 to 25% after a few weeks, and in people practicing longer by as much as 30 to 40%. This is not a subtle difference, it is a change of clinical significance, comparable to the effects of mild tranquilizing medication. Since 2014, WHO has classified spirituality as a protective factor against chronic stress, noting that people with developed spiritual practices have a 40 to 60% lower risk of experiencing a depressive episode within 5 years. Epidemiological studies involving more than 70,000 people, a meta-analysis by Koenig et al., Duke University, have shown that spirituality, understood as a sense of meaning, participation in rituals, and practices of quiet, correlates with a 45% lower risk of suicide attempts and a 30% lower rate of psychiatric hospitalization. This does not result from meditation or prayer alone, but from the fact that spirituality creates a strong inner point of reference that stabilizes the psyche in times of crisis. Data from the American Psychiatric Association also show that people who regularly engage in spiritual rituals, not necessarily religious, display better emotional regulation. Scores on neuropsychological tests show a return to baseline after stressful stimuli about 20 to 30% faster than in control groups. This is the effect of activating the parasympathetic nervous system, the body's primary mechanism for switching off the stress response. At the same time, studies have shown that spirituality increases long-term psychological resilience. Logotherapeutic research models, for example, the work of Frankl and contemporary analyses by V. Bathiani, confirm that a sense of meaning reduces the risk of depression by around 40% and the risk of addictions by as much as 50%. A person who has a clear value system and a spiritual narrative is less likely to fall apart under life's burdens, not because they are biologically stronger, but because they possess inner interpretive frameworks that cushion tension. Neurobiology also provides hard evidence. fMRI studies show that spiritual practices strengthen activity in the anterior cingulate cortex and prefrontal cortex, areas responsible for emotion regulation and inhibition of fear responses. After around 8 weeks of regular practice, there is a clear calming of the amygdala, the structure responsible for the fight or flight reaction. This is one of the best documented neurobiological effects of spirituality. For the caregiver, this knowledge has one practical meaning: spirituality genuinely reduces psychological overload and lowers the risk of burnout. Not symbolically, not philosophically, but biologically and clinically. That is precisely why so many modern caregiver support programs in Europe, Asia, and the USA alike include modules on spirituality alongside pharmacotherapy and cognitive behavioral therapy. The caregiver's spirituality: why it protects against burnout. Caring for a person with a mental illness is an extremely burdensome experience, not only emotionally, but biologically as well. Chronic stress, constant vigilance, lack of predictability, and responsibility for another person's safety keep the caregiver's nervous system in a constant state of alarm. People can live in this state for months, sometimes years. Without the right tools, this leads to burnout, depression, sleep disturbances, and complete exhaustion. Spirituality is one of the few resources that can genuinely interrupt this mechanism. Spirituality protects primarily because it relieves the caregiver's mind of the duty to hold the whole world on their shoulders. When a person has no deeper point of support, all responsibility for the life, health, and future of the ill person falls directly on them. This is a kind of burden no nervous system can bear in a healthy way for long. Spiritual practice, regardless of its form, brings in another perspective. It allows you to see caregiving not as a heroic task beyond human strength, but as one of life's experiences, lived through step by step, breathing rather than fighting. Another protective mechanism is emotional regulation. A caregiver who lives without moments of quiet often enters a state of psychic clenching, a tension in which every small situation provokes a stronger than normal reaction. Spiritual practices such as meditation, prayer, contemplation, recitation of formulas, or mindful breathing soften this state. They do not do this metaphorically, they literally calm the sympathetic nervous system and activate the parasympathetic nervous system, responsible for regeneration. Over the long term, this means fewer angry outbursts, less guilt, and less accumulating fatigue. Spirituality also protects by providing meaning. Long-term caregiving can slowly eat away at all other areas of life: hobbies, relationships, career plans, free time. A person without a spiritual foundation can easily begin to feel that their life has been reduced solely to duties. This is a very dangerous moment. Psychologically, it signals a loss of direction. Emotionally, it leads straight to depression. Spirituality restores that direction because it allows you to see meaning that does not depend on the ill person's state and does not end with their relapse. It gives you an inner axis, something that does not change under the pressure of daily crises. An important aspect is that spirituality also loosens the caregiver's loneliness. Someone who carries a heavy burden for years usually ends up carrying it alone. Not because others abandon them, but because they cannot enter that space. They do not know how to talk about it and do not understand the scale of the strain. Spiritual practices reduce this sense of isolation because they create a steady connection with something beyond everyday life. Sometimes it is a relationship with values, sometimes with nature, sometimes with God, sometimes with one's own conscience. For the caregiver's psyche, this makes a huge difference. They cease to be a solitary individual fighting chaos and become part of a larger order. Spirituality also works at the level of identity. A caregiver often loses their sense of self because their whole life is defined through the lens of the other person's illness. Spiritual practices remind you that you are more than a caregiver, that your dignity, worth, and meaning are not confined to a single role. This sense of being more than that is one of the strongest protective factors against burnout. This is why therapists increasingly encourage caregivers to develop spiritual foundations, treating them as a key element of mental health prevention, not an optional extra. Modern medicine does not seek to replace spirituality. On the contrary, it recognizes that without it the caregiver loses strength more quickly, copes worse with stress, and is more likely to fall into depression. Eastern spirituality as a source of psychological stability. Modern science is increasingly emphasizing that the most mature and stable spiritual systems, those that genuinely support mental health, come from Eastern traditions. Not because they are exotic, but because for thousands of years they have been working with the human mind in ways now confirmed by neurobiological research. Buddhism, Taoism, and Hinduism do not focus on dogma but on inner practice, calming the mind, reducing suffering, cultivating mindfulness and acceptance. Their primary aim is not salvation or the performance of rituals, but freeing the mind from unnecessary tension, exactly what both the caregiver and the person with a mental illness need. For centuries, Buddhism has described suffering as the result of constant grasping and rejecting, a mechanism that modern psychology calls emotional reactivity. Meditation, mindfulness of breathing, contemplation of impermanence and compassion are tools that not only calm, but also teach the mind to function beyond impulses and tension. fMRI studies show that 8 to 12 weeks of mindfulness practice, derived directly from Buddhism, reduce amygdala activation, improve concentration, and increase stress resilience. For someone who has been caring for an ill person for years, this is not an extra, it is a systematic way of protecting their mental health. Taoism, in turn, teaches gentle alignment with the natural flow of things, without violence against oneself. Its principles are simplicity, unforced movement, and acceptance of what cannot be changed. Taoist meditation, breathing exercises, and the practice of Wu Wei, action without strain, help the caregiver step out of the trap of "I must control everything." From the perspective of clinical psychology, Taoism is one of the closest equivalents to modern acceptance and commitment therapy, ACT, which teaches people to live more fully despite difficulties, rather than by fighting them. Hinduism, especially its yogic tradition, brings to spirituality the practice of balancing body and mind. Pranayama, or breath regulation techniques, has become the basis of modern stress reduction methods used in trauma and anxiety therapy. Research shows that even a few minutes of calm breathing a day lowers blood pressure, stabilizes heart rate, and reduces sympathetic arousal. For a caregiver whose body has been in a state of alarm for years, such practices are among the most accessible and effective tools for calming down. All these traditions share a common core. They teach how to live closer to one's inner world, how not to react impulsively, how to accept the nature of experience, and how to reduce suffering by quieting the mind. This is why they connect so naturally with a universal, non-religious spirituality. A caregiver does not have to become a follower of any tradition. It is enough to draw on their techniques, which have served humankind for centuries as ways of calming the mind. In everyday caregiving, Eastern practices introduce predictability, ritual, and gentleness, the very opposite of chaos. They also create a space in which the caregiver can find the breath, meaning, and strength that cannot be drawn from pharmacology and therapeutic protocols alone. That is precisely why so many modern therapeutic models integrate Eastern practices as a fully fledged element of mental health support, including for caregivers. Spirituality of the person who is ill. The spirituality of a person who is ill is a sensitive subject, because it is easy to fall into one of two extremes, either treating it as a magical solution to mental health problems, or as something unnecessary that does not matter compared with pharmacology and therapy. Contemporary psychiatry makes it clear that neither of these extremes is true. Spirituality is not a medicine, but it is one of the most stable factors regulating emotions and therefore genuinely facilitates the treatment process. People with mental illness live in a world with a much higher intensity of stimuli than people who are well. Anxiety, tension, a sense of threat, and thought chaos are their everyday reality. This means that the natural mechanisms that stabilize the psyche work more weakly or are quickly exhausted. In such an environment, any form of repetitive, predictable ritual, even a very simple one, acts like an anchor. This is precisely why spirituality plays such an important role. It introduces structure where everyday life has no structure. In the ill person, spiritual practices most often work by regulating the nervous system. They calm the breath, restore rhythm, lower arousal, and allow a person to detach from the flood of thoughts that often turns into anxiety or agitation. A short ritual, such as lighting a candle, saying a few sentences together, a moment of meditation, or mindful breathing, can reduce tension faster than a long conversation. From a clinical perspective, this is a natural form of emotional regulation consistent with the treatment model, not an alternative to therapy. Spirituality in the ill person also works because it organizes interpretive chaos. People with mental disorders often cannot clearly name their feelings, recognize tension, or distinguish real danger from internal arousal. Spiritual rituals, even symbolic ones, create a language through which the person can describe their experience in a less chaotic way. This is not about metaphysics, but about putting experiences in order which would otherwise trigger fear or aggression. Many people with mental illness also find a sense of meaning in spirituality. Illness often takes away a person's sense of identity, life continuity, and direction. In such a situation, spirituality, regardless of its form, restores a minimal sense that life has meaning and that daily difficulties are part of a wider process, not a punishment or an absurdity. From the perspective of psychiatry, this is a key element in stabilizing mood. A person who can give meaning to their experiences is less likely to fall into despair, and their motivation for treatment is higher. One thing must be emphasized, however: spirituality does not replace psychiatric treatment. It does not cure psychosis, it does not stop delusions, and it is not an alternative to therapy. It is a regulating and supporting space, a place where the person who is ill can live through the day more calmly, with less anxiety, and sometimes with greater openness to cooperating with treatment. When spirituality is well guided, gentle, calming, without moralizing, it acts as a shock absorber in difficult moments, not as an attempt to replace pharmacology. It is important to remember that the ill person's spirituality should always be voluntary. Nothing that is forced will work. If the person feels resistance, it means the ritual must be simpler, shorter, more neutral, or put aside entirely for later. The aim is not to teach spirituality, but to create conditions in which anxiety and tension will ease, even for a moment. For the caregiver, this perspective is important for another reason. When the ill person experiences even momentary calm thanks to spiritual practices, daily cooperation becomes easier and their mood swings are less violent. This is a real relief for the caregiver, and one of the foundations for keeping the relationship from being constantly based on crisis. Evidence-based spiritual practices: what really works? In spirituality, what matters most is not theory or beliefs, but practice that can be done every day, even when you are tired, overwhelmed, or completely out of energy. Modern medicine clearly indicates that certain forms of spirituality have a stabilizing effect on the nervous system, which means they reduce stress, improve mood, and increase psychological resilience. These are not symbolic practices, they are methods with a measurable psychophysiological impact. The best studied form of spiritual practice is mindfulness meditation, which originates in the Buddhist tradition and is now used in clinical stress reduction programs, MBSR, depression therapy, anxiety treatment, and PTSD. Its effect lies in calming the sympathetic nervous system and restoring balance to breathing and attention. Studies show that 8 weeks of regular practice lowers cortisol levels, reduces amygdala activation, and improves concentration. For the caregiver, this means more calm, less tension, and greater resistance to everyday stressors. The second well-documented practice is simple breathing meditation in its most basic form, observing the in-breath and out-breath. This is not a technique reserved for experienced practitioners. A few minutes a day are enough for the nervous system to start calming down. Breath is a direct pathway to regulating emotions, because it affects the vagus nerve and the parasympathetic nervous system. In practice, this means that the caregiver can return to balance much more quickly, and the ill person can reduce the intensity of anxiety or agitation. Another practice with proven effectiveness is a short, daily pause with a ritual character. It does not have to be a religious ritual. It may be lighting a candle, a moment of silence, a symbolic gesture, or saying one sentence that has meaning for you or the ill person. Research shows that the sheer fact of repetition and predictability of a ritual reduces emotional tension and gives the psyche a sense of safety. Spiritual rituals act like an anchor, a fixed point in a day that is often chaotic and exhausting. Prayer, understood as a form of focused reflection, also has a regulating effect. It does not have to be tied to any religion. It may be the quiet recitation of a few sentences that help you sort out your thoughts. In neurobiological research, prayer activates brain areas responsible for emotion regulation and the inhibition of fear impulses. Its advantage is that it can be done anywhere and its effects are immediate. Many caregivers and many ill people also benefit from the practice of walking meditation, a slow, mindful walk that combines movement with awareness of breath and the rhythm of the steps. Studies on walking meditation show that 10 to 15 minutes of practice a day reduce tension levels, improve mood stability, and reduce symptoms of somatic stress, such as chest tightness or muscle tension. It is an ideal form for people who cannot sit in silence for long, and there are many such people among those with mental illness. A practice with growing scientific support is also the gratitude journal, writing down 3 simple things that were good that day. Research shows that regularly keeping such a journal reduces depressive symptoms and improves well-being. This is not a positive thinking technique. It is a way of reprogramming attention which, under chronic stress, tends to focus only on threats. All these methods have one thing in common: they do not require belief in any religious system and are not tied to any specific tradition. They are tools for regulating the psyche that grew out of spirituality but have been scientifically validated. The caregiver and the ill person can use them regardless of their beliefs. Their shared goal is one thing: to reduce tension and restore balance, which in caring for a person with mental illness is one of the most precious resources. Bringing spirituality into everyday life. Bringing spirituality into caring for the ill person requires, above all, gentleness. It is not a system you can impose, just as you cannot impose medication or safety rules. Spirituality only works when it appears naturally, unobtrusively, and without pressure. Any attempt to persuade the ill person by force ends with the opposite effect: tension increases, resistance appears, and the ritual loses its calming effect. The key is to create conditions in which both caregiver and ill person can enter into spirituality, but no one is pushed into it. The most important rule is simplicity. The ill person does not need elaborate ceremonies or long practices. On the contrary, their nervous system tolerates best what is short, predictable, and repetitive. Instead of building complex rituals, it is better to choose something that can be done every day, even in a difficult mood: lighting a candle, a few minutes of silence, quiet breathing, a short mantra, or a single sentence of reflection on the day. Spirituality then becomes a component of emotional regulation, not yet another task. It is precisely this repetitiveness that is crucial. People with mental illness often live with a sense of chaos and uncertainty. A steady, gentle ritual is a place of support where they can briefly regain a sense of control. Even if the ill person does not participate actively, the very atmosphere of quiet and predictability has a soothing effect. Research in community psychiatry shows that it is not the form of the ritual but its regularity that most strongly lowers anxiety and tension. When guided wisely, spirituality also becomes a bridge between caregiver and ill person. Many families experience situations where conversation on an ordinary, everyday level is difficult. the ill person has no strength, the caregiver has no resources left, and every meeting turns into behavior correction or conflict. A spiritual ritual creates a space in which these mechanisms stop operating. The ill person does not have to explain themselves, the caregiver does not have to control. For a moment, both participate in the same calm experience. This builds connection in a way that cannot be achieved through conversation under stress. Shared practices should not be long. A few minutes of quiet, one sentence of gratitude, a short breath, or a symbolic gesture to end the day are enough for a sense of togetherness to arise. Even such simple rituals have documented effects. They reduce anxiety, lower cortisol levels, improve sleep quality, and stabilize mood. For the ill person, who often cannot name their emotions, the ritual is a way of organizing them. For the caregiver, it is a moment to breathe and an opportunity to strengthen the relationship without tension. When introducing spirituality, you must remember one rule: nothing that is meant to heal can be a source of pressure. If the ill person refuses to take part, the ritual can be performed by the caregiver alone, and even then it is beneficial, because it creates a space of quiet in the home and reduces overall tension. Paradoxically, it often happens that when the caregiver practices calmly and without expectations, the ill person begins to show interest and spontaneously joins in, because the atmosphere of calm is more convincing than any argument. Spirituality in care is therefore not about teaching the ill person, but about creating daily conditions for peace, introducing predictability, and building a relationship that is not based solely on tasks and crises. It is a tool that helps both sides, the ill person by reducing their anxiety and tension, and the caregiver by giving them a moment to breathe and a sense that in the chaos of the day there is at least one moment that nothing disturbs. Summary: spirituality, understood as contact with a deeper sense and with calming practices, is not an add-on to caring for a person who is ill, nor something to consider only once the situation has settled down. It is one of the pillars of mental health, confirmed both by clinical research and by the experience of thousands of caregivers. In the daily chaos dominated by tension, unpredictability, and constant responsibility, spirituality becomes a space of regeneration, something that allows you to breathe, see a broader perspective, and regain balance. In this lesson, you have seen that spirituality operates on a very concrete level. It reduces stress, stabilizes emotions, calms the nervous system, and strengthens psychological resilience. It helps both the caregiver and the ill person, but in completely different roles. For the caregiver, it provides strength and meaning; for the ill person, predictability and quiet. Shared rituals create a space in which the relationship is no longer dominated by crises and begins to rest on calm and simple moments of connection.